A team of 16 doctors, nurses, and support staff from Scripps Health will leave for Nepal in the next few days and stay for at least 3 weeks. Joining me with what the team plans to do are my guest, Chris Van Gorder, President and CEO of Scripps Health, and ER Dr. Mark Olcott, also with Scripps. And Chris, now Scripps has already sent trauma teams, right, in the aftermath of Katrina and in the aftermath of Haiti, right,
That's
to help
correct.
there.
That's correct.
So do you know yet where this team is going to go and who the first likely patients will be?
We don't. Everything's very fluid. The International Medical Corps sends in an assessment team. They actually flew in with the FEMA USAR team, and they've been there for a number of days, not only looking for a location for the medical care, but determining where the mobile field hospital, if it's deployed, would be located. So we anticipate we'd fly into Kathmandu, and then most likely, if the hospital is set up, it would be set up probably at the airport. If not, we could go anywhere in the country.
And Dr. Olcott, so the patients then that you might be seeing then, it's been almost a week since the 7.8 quake. So what types of conditions or medical conditions will you be treating?
We're really anticipating a variety of things, Peggy. Certainly, by the time we arrive there will still be some trauma patients who have not yet been able to access care. So certainly we'll have traumatic injuries, broken bones, crush injuries, wounds to care for. But we also anticipate there will be a large number of people with chronic medical conditions, that will have been become unstable because of the lack of care and because of the stress of the earthquake. And then certainly as time goes on, during the course of our 2 to 3 week deployment, the concern would be for communicable diseases, infectious diseases related to poor living conditions and related to close quarters. So we're really preparing for a broad spectrum.
So maybe contaminated water, dysentery, things
That's
like
a large
that.
concern.
I see. Chris, how does Scripps benefit from sending medical teams like this to disaster areas?
Well, I can tell you morale's up at the organization right now, just with the employees and doctors knowing that we're going to do something as important as this. But most important is we bring back experience. A disaster could hit our community any time, earthquakes and fire being the most likely. We've had a chance now to be in Haiti and see exactly what it's like to work in austere conditions with terrible crush injuries and things like that. We're going to be able to see it again in Nepal. We bring that experience back so we can understand and be able to not only teach it, but if it ever happens here, we're going to be ready for being able to do things when not all the equipment and people are available to help.
And that brings me to a question for you, Dr. Olcott. So certainly running water, things that we take, sterile environment that we take for granted here in the States in good times. Is there special training or preparation that the medical team has to go through?
There is, and we've done an extensive amount of training within the California Mobile Field Hospital. Most of us, though, virtually all of us, have actually had experience either in the military setting or in a deployment, as Chris mentioned, in Haiti after the earthquake there. So we're accustomed to the changes you have to make when you step out of the hospital and into the dirt, quite literally, to care for people. And it's always interesting to see how much you can really accomplish. We love the great facilities we have at Scripps and the other healthcare facilities in San Diego, but you can do a lot of good for folks even with relatively simple conditions and simple equipment.
So as a doctor, why you have a nice ER facility? Why are you going over to Nepal?
The bottom line is really this is why everyone on the team and really all of our colleagues at Scripps went into healthcare. Is really to take care of people. And day in and day out in American healthcare, there are a lot of things that kind of get in the way of that. And this opportunity to really do, pure care for someone in desperate need, is an amazing opportunity and something that doesn't come along that often. So really, while it sounds kind of simple, is a very powerful motivator for all of us who are involved.
Well, Chris, you've been on the front lines after disaster on that. What's it like being there, helping these people that are so desperate for help with not a lot of resources?
Yeah, it's an incredible experience. I mean, it's even hard to explain. I think all of us, when we see a disaster hit, I'm sure there's viewers right now that are looking at Nepal saying, I wonder what I could do to help. Well, we have the ability to help, and we've gone a number of times, and we have deployed and with our badges, our identification with an American flag on it, and they didn't know who Scripps was, and they could care less. They didn't even know who we are, but they saw the American flag, and you could see them in Haiti. You could see them warm up the minute they knew that the Americans were there to help. And yet when we were leaving, you could actually see the fear coming back on their faces because they knew we were going to leave them alone again. But probably the thing that did it all for me was in Hurricane Katrina. when one of the convention centers was being, the people were being forced to leave again because of Hurricane Rita. One of our team members found a yellow card on the ground that was clearly made by a child, and it just on the front it said "Have Hope," and you open it up, it was unsigned, but it said "Help is on the way." And so that's what people are looking for. They need to have hope because help is on the way.
All right, Chris Van Gordon and Dr. Mark Olcott, thank you so much.
Thank you.
Thank you.